Everybody, no, we're still waiting. All right. All right, as everybody's coming in, we'll go ahead and get started. Thank you all for being here. We are going to have a budget hearing today on 3 budgets. We are going to start with the Office of Deaf and Hard of Hearing. We are going to then move on to the Department of Human Services, Office of Hemp Energy Programs, and then we will conclude with the Department of Health's Public Health Administration. Before we jump in, a couple quick reminders. This is being streamed live. Anything that is said was going out on YouTube and archived for public consumption. That also applies to anything in the chat. So just be mindful of that. The other quick housekeeping thing is we at 1:30, I personally have a bill hearing in another committee. So around that time, I will jump off. I will hand off to the Vice Chair, Delegate Valentino Smith. And then we will continue on. I will come back as soon as I can. Final reminder, I am asking all members of the subcommittee and anyone speaking to be on camera, to have your cameras on and be on camera for the duration of the bill hearing, so long as you are in it. So with that, let us kick off with the Office of Deaf and Hard of Hearing. We will start with the budget analyst, Grace Pedersen, who will present the analysis. Grace, go ahead.
Thank you, Mr. Chair. It's my pleasure to present the Office of Deaf and Hard of Hearing's fiscal 2023 budget analysis. As you can see in this first graph, the budget remains level from fiscal 22. Most of the budget is for personnel, followed by the next largest chunk being sign language interpreting services. The budget changes mostly for personnel expenditures, both in regular positions and a part-time graduate assistant position. The department doesn't gain or lose any positions or contractuals in the allowance. The budget, the first issue is about sign language interpreter complaint reporting. So this graph is showing the number of complaints that constituents that were deaf or hard of hearing reported to the Maryland Commission on Civil Rights. So the number reported each year is relatively low, never exceeding 14 complaints over this 7-year period. However, in the past, the office has indicated that they've received thousands of complaints from deaf and hard of hearing individuals, and that most of those complaints pertain to sign language interpreters. So last year, the committees requested that the department submit the number of these types of informal complaints and also data about the industry that the complaints were pertaining to, whether unsatisfactory interpreters were found in medical settings or legal settings, educational. That data hasn't been submitted, but instead the office has established a complaint reporting form on its website. In the 2020 interim, the office submitted a report about the various policy options that the state could implement to protect users of sign language interpreting services. And these policy options ranged from establishing a full licensing board to just creating regulations to kind of protect users of those interpreting services. The department has not submitted a bill to effectuate any of these policy changes as of this writing. Looking at the second issue, this pertains to utilization of services designed for deaf and hard of hearing individuals. And there's been some decreases in some specific services. Namely, there's been fewer children served through the Hearing Aid Loan Bank from fiscal 2020 to 2021. And looking at Exhibit 4, this is eligibility determinations for the Telecommunications Access of Maryland program and the Division of Rehabilitative Services programs designed for deaf and hard of hearing individuals. And there's a substantial decline in from fiscal 2020 to 2021 in both of those services. Otherwise, DLS recommends to concur with the allowance, and that concludes my presentation. Thank you.
Thank you. Any questions for Grace? Seeing none from the committee, I'll now turn to the department. With us is Mr. Kelby Brick, the director of the office, and Mr. Patrick Lally. And I'll turn it over to you, and please provide us with your response to the analysis.
Could we spotlight Director Brick, please?
Staff, can we spotlight Director Brick?
He is spotlighted now.
All right. Good afternoon. Good afternoon, Chair and members of the committee. I'd like to take this opportunity, and I'd like to thank you for the opportunity to be here. I very much appreciate the legislative analyses and the recommendations of approval of the proposed budget for this office. For the last year, we have been involved in many, many successes. One of the ones I'd like to highlight is setting up text to 911 services throughout the state. This is mission critical for the deaf and hard of hearing community to be able to contact 911 as needed through text without having to go through the long, complicated, arduous process of doing it through Relay and a third party. For anybody else who might also need that service, it is also available. So it definitely follows universal design. I'd also like to highlight the fact that the Health Science Center recently completed a survey of a variety of states throughout the US in terms of the deaf and hard of hearing community's experience and the service they've been provided, the level of service during the pandemic. The survey showed unequivocally that deaf and hard of hearing citizens in the state of Maryland are very satisfied with the service they've received from the state, and we're very, very proud of that. And we are committed to continuing to work hard to ensure that deaf and hard of hearing constituents have full access to all the information necessary to keep themselves healthy and safe during the pandemic. You've received my written testimony, and I'm happy at this time to accept any questions that you might have for our office. Thank you so much for your time.
Thank you for that presentation. Mr. Lally, are you also presenting, or are you just here for questions?
Just here for questions, Mr. Chairman. Thank you.
Thank you. Any questions for the department? Delegate Valentino Smith.
Thank you, Mr. Chair, and thank you, Director Brick. Congratulations.
Oh, 1 second. I'm sorry, Madam Vice Chair. I'm sorry. Could we spotlight the interpreter so I can see them, please? I'm sorry. Thank you. Please continue.
Thank you, Director Brick, and congratulations on your achievements with the 911 texting and on the surveys and the high ratings that you're getting for work during the COVID. So you've been before us before, and you have heard the concern that we have regarding the part of the analysis that starts on page 5, where it says Maryland is unique in that it does not have any statewide standards for sign language interpreters. Other states have implemented competency standards for interpreters, specific standards for interpreters that serve in specialized settings, or an oversight body to monitor interpreters. And because of that concern, we asked for a JCR report in 2020, and the JCR report came back with the findings that we see on page 6. And if I recall, because during pandemic, we're at home and I've got my work file at work, but we'll trust some memory. I think that we've been pushing you all as the experts in this to affirmatively lead with what our state should be doing with respect to the recommendations that came forward on regulations or statutory changes. What have you done since 2020 to bring us up to par with the other states in terms of a regulatory or oversight process?
Thank you, Madam Vice Chair, for that fantastic question. I always appreciate having discussions about this process. You are absolutely correct. We drafted a response to 2020's JCR, identifying, if I remember correctly, 5 different options of how to move forward in addressing this issue. In addition to that, we received questions after that from yourself as well as others asking us to specify what processes and what procedures can be taken and implemented. Now, under the current administration, they've preferred option number 3, taking a more incremental approach to the process. If you feel that more action should be taken, our written response from the previous year, we do mention within that response that there is approach number 2, which would amend the acting legislation to essentially allow our office to look into this issue with a little more depth, a little more clarity, and possibly do a regulatory approach. If you want to pursue that, we would be happy to follow up on that later and continue to work on that. Now, there are some specific bills that have been introduced during this legislative session by other senators that I'm aware of that are also the goal of which is to address this issue. So, I mean, I am more than happy to have conversations with you on how to best address it later in terms of possibly using your authority and your power to change the regs. But at this point, our response from last year stands.
Thank you. I appreciate the sincerity of your willingness to work with us. And just to clarify, in picking option number 3, if that's the correct one, it said regulations that would protect and serve. Have you promulgated any regulations?
We haven't gone through that process as of yet. We are still in dialogues with various stakeholders in the community, including this administration, as well as outside community stakeholders, trying to develop a framework of what the best approach might be. Now, there are several bills that propose different approaches to addressing the concern of fraudulent and unqualified interpreter. They might have a different approach. We don't have a position on any of the bills that have currently been introduced to legislation at this point.
Thank you. I find it naturally frustrating that for 2 years we've been told that we're a state that doesn't really provide any regulation, and that it at least appears we still are not arriving at a conclusion on how to best protect the public and the community with ensuring the integrity of the interpreters. Thank you, Mr. Chairman.
Thank you. Appreciate it.
And I appreciate, my apologies, I appreciate and share that frustration, Madam Vice Chair. It's a very interesting and very complex issue. So thank you.
All right. Any additional questions for the department? Seeing none, I will just remind the committee that there is also written testimony from Kevin Chanchow of the Lith Home LLC in your materials. With that, that concludes the budget hearing for the Office of Deaf and Hard of Hearing. We are now going to move on to the Department of Human Services, Office of Home Energy Programs. We will start with the budget analysis with Sam Quist, and then go to the department afterwards for a response. So Sam, please take it away.
Good afternoon. Thank you. I will be presenting the analysis for the Department of Human Services Home Energy Programs. You should see the document on your screen now. The FY23 allowance for the Office of Home Energy Programs totals $195.9 million. And this is a decrease of $46 million from the fiscal 22 working appropriation. This decrease is primarily due to the effects of one-time federal stimulus funding received in fiscal 22, which is partially offset by increased special fund revenue in fiscal 23 from the Strategic Energy Investment Fund for Energy Assistance. Exhibit 1 shows the number of applications per year, as well as the number of households receiving benefits for each of the 4 main energy assistance benefit programs offered by DHS. The number of total applications increased by approximately 9% in fiscal 21, which was the largest percent increase year over year since about fiscal 2010, and the first year of increase since about fiscal 2017. And this increase corresponded to the end of the utility termination moratorium that was in effect between March 2020 and November of 2020, towards the beginning of the pandemic. Once this moratorium on utility terminations expired, we began to see an increase in demand for energy assistance benefits. And despite these increases in applications in fiscal 21, only the 2 arrearage assistance programs saw increases in households receiving benefits. 2 bill pay assistance programs, the Maryland Energy Assistance Program and the Electric Universal Service Program, saw no increase in households receiving benefits and were consistent with prior years. Exhibit number 2 of the analysis shows data on applications and benefits for the current fiscal year, fiscal 22. This data is through November, so the first 4 months of the fiscal year. In fiscal 22, we are seeing applications returning to a declining trend compared to the increase seen in fiscal 21. And the number of households receiving benefits is also declining for 3 out of the 4 programs, with the electric arrearage assistance showing about a 25% increase. At the same time as these decreases are occurring, this data is showing that the average dollar amount for benefits per month has increased. This increase is due to a couple of different factors. The first factor is the fact that the cost of energy has generally been increasing in recent months, and the amount of energy benefits, that's one of the components that it's calculated off of, is the cost of electricity and cost of other energy. There were also a couple increases in benefit amounts that were announced. The governor announced an increase in minimum benefits for the bill pay programs. For the Maryland Energy Assistance Program, the minimum benefit amount was increased from $300 to $500. The minimum benefit for the EUSP bill pay program was increased from $150 to $300. And a supplemental benefit, which would be approximately $83 per household per month for bill assistant, was also included. And in addition to those increases in benefits, you can also see in this percentage of bill pay section of this chart, for the electric assistance, the percentage of bill paid was increased in fiscal 22 as well. So if you compare these average dollar amount per month per household amounts in this chart to that of prior fiscal years, the average benefit amounts per month is now some of the highest amounts in program history. Looking at the historical data, the dollar amounts were rarely over $600 per month in prior years. And as you can see, they're all over $700, with the highest being the EUSP arrearage over $900. As a result, the total spending, which is the last area on this chart, shows about a 40% increase in total spending on energy assistance in fiscal 22. The next chart, just wanted to highlight, there was a change in statute for individuals over the age of 67 for eligibility for energy assistance benefits. This was one of the components of Chapter 638 and 639 of 2021, which raised the income eligibility from 175% of the federal poverty level to 200% of the federal poverty level, which in this chart, this is listing this middle group of columns for participation rates for households with an individual over age 70. You can see a corresponding increase there. We've asked the department in their testimony to include some additional information on the number of households who were impacted by that change. We move now to a brief discussion about federal stimulus funding received in state fiscal 21 rather. The Office of Home Energy programs received approximately $19.4 million from the CARES Act for the Maryland Energy Assistance Program for supplemental funding. Additionally, the supplemental budget number 5 of the budget bill last year during last session included a total of $20 million from the American Rescue Plan. This was allocated in $10 million amounts for both fiscal years 21 and 22. And there was a component of Chapter 638 and 639 which mandated that any unspent funds from this allocation for fiscal year 21 should be included in the fiscal 23 allowance. And as mandated, there are $570,000 approximately of this federal stimulus funding included in the fiscal 23 allowance that was unspent in fiscal 21. There are 2 main deficiency appropriations in fiscal 22 appropriating some additional stimulus funding. The first is $73.5 million in supplemental funds from the Low Income Household Energy Assistance Program, which is the federal program that federal funding is appropriated through. This funding included approximately $40 million to fund supplemental benefits and increase minimum benefit amounts in the Maryland Energy Assistance Program. There was also about $16 million for weatherization assistance, which is funded through the Department of Housing and Community Development. The second deficiency appropriation contained $14.1 million in funding. This is for the Low Income Household Water Assistance Program, which is a new program announced by the U.S. Department of Health and Human Services for bill pay and arrearage assistance for water and wastewater, which I'll talk a little bit more about later on in the presentation. Lastly, in the Infrastructure Investment and Jobs Act recently passed by Congress, there was a supplemental appropriation to the LIHEAP program as well for between federal fiscal year 2022 and 2026. And the U.S. Department of Health and Human Services announced that Maryland would receive approximately $1.5 million from this appropriation in federal fiscal 22. However, this amount has not been allocated yet, so it's not taken account in the budget data yet. Turning to the overview of agency spending in the fiscal 23 allowance, as you can see, the majority of the budget, around 93%, is covering energy assistance benefits. About $69 million or 35% of the overall total is for the Maryland Energy Assistance Program. And there's a total of $144 million, which is covering the Electric Universal Service Program. This is a combination of special funds from ratepayer surcharges on electric bills, a PSC, Public Service Commission ordered settlement funds, and funds from the Strategic Energy Investment Fund, which are statutorily allocated into the Energy Assistance sub-account of that fund. There are also a couple smaller mandated funding amounts. As I mentioned, there was the $570,000 for federal stimulus funds. There's also an $80,000 mandated funding amount of general funds, which is new for fiscal 23 for the Power to the People pilot program, which supports the Critical Medical Needs Program to assist those individuals in accessing energy assistance benefits. Turning to the changes in the budget in FY23, as previously mentioned, these 3 main decreases are related to the federal stimulus funding in fiscal 2022. And the one main increase in the budget is the $50.9 million in increased Strategic Energy Investment Fund spending. This increase is due to increased overall revenues for the Strategic Energy Investment Fund received through the allowances from the Regional Greenhouse Gas Initiative auctions for carbon dioxide emission allowances. As shown in Exhibit 8, this is a summary of these auction revenues In auction number 54, which is the most recent one held in December, the auction clearing price reached $13 per allowance, and the total amount received by the state of Maryland was $44.2 million. This is a dramatic increase, and those are both the largest dollar amounts in program history of Maryland's participation in the program. There's been a consistent demand for those carbon dioxide emission allowances. And in statute, 50% of these revenues are dedicated to the energy assistance subaccount, which partially funds energy assistance benefits. Due to these increases, Exhibit 9 shows the estimated fund balances for the subaccount. So between fiscal 2021, the closing balance was about $44.7 million. And this is increasing. The estimate by the Maryland Energy Administration, which is the administrator of the fund, has an estimate of $66.9 million at the end of fiscal 2022. And following the projected spending in the Office of Home Energy Programs in fiscal 2023, there's about a $17.7 million fund balance remaining. Although this is likely understated from what the actual closing balance is, because they use a rather conservative estimate for estimating the fund revenue coming in, which uses a lower auction clearing price in order to prevent any, if there are unpredictable decreases in actual revenue, it insulates any programmatic changes having to occur by providing a more conservative estimate for the current year.
Sam, let me interrupt you for one quick second, if I may. At this point in time, I need to jump off to go to my bill hearing. I'm going to hand the reins over to Delegate Valentino Smith to manage the rest of the budget hearing until I return. So I hope to be back as soon as I can, and please continue without me. Thank you.
Sure. The next section in the analysis is the personnel data overview. So there are a total of 14 positions in the office. This is an increase of a half of a regular position due to the conversion of an existing part-time position to a full-time position. And the current vacancy rate, there's 2 vacant positions that were listed at the end of calendar 2021. Moving to the issues section of the analysis, the first issue is discussing the denial rates and reasons for denial for energy assistance benefits. As shown in Exhibit 10, the most common reason for application denial is due to incomplete information. This was consistent with data provided in prior years by the department. However, there was a statutory change, chapters 638 and 639 of 2021. It changed the procedure so that a household with a denied application had an additional 3 months after receiving a notification of denial in order to provide missing documentation if that was the reason for the denial. And during that 3-month documentation, they could household could supply any missing documentation in order to cure the application and remedy it being denied if they were otherwise eligible. Exhibit 11 shows the denial rates per year. As you can see, the rates for all 4 programs increased in fiscal 2021, and the denial rates specifically for the 2 arrearage assistance programs saw the highest rate of increase. They increased to a level higher than in recent fiscal years, and were almost double the rates in fiscal 2020. The denial rates for the 2 bill pay assistance programs also decreased, but not as high of a level. And for the 2 bill pay assistance programs, however, in fiscal 22, for the first 4 months that we have data for, they've actually declined pretty substantially by about 44% each, to some of their lowest levels since about fiscal 2015. However, the denial rates for the two arrearage programs in fiscal 2022 year to date, they've also declined, but they're still remaining higher than the previous two fiscal years. So we've asked, in the analysis, we've asked the department to comment on some of the factors impacting these changes in denial rates. The analysis document also includes some data provided by the department on average processing times for these applications. The exhibit number 12 shows the average number of days statewide and by jurisdiction for each of the local administering agencies for the average number of days to process an application. The chart is laid out that the first column is the reporting period of July 1st through November 1st of fiscal year 2021. The second column is the full year data for fiscal 2021. And then the third column is the most recent data for fiscal 2022 from July 1st through November 1st. So comparing the end of year fiscal year 21 data to the first 4 months of fiscal 2022, there is about a statewide decrease in 8 days from 30 days to 22 days. As far as the individual local administering agencies, there were nine jurisdictions that saw increases in processing time since the end of fiscal 21, and there were 11 that saw decreases, with the largest increases in that time period occurring in Allegheny County and the jurisdictions serving Southern Maryland, which includes Calvert, Charles, and St. Mary's County. In Allegheny County, there was a transfer of administration between county offices. However, for the other counties, we're asking the department to comment on any factors that are impacting these changes in processing times. The other exhibit in the analysis shows the percent of applications processed beyond the 55-day benchmark. This is an informal benchmark used corresponding to the termination protection period while an application is pending. And there were about 14% statewide at the end of fiscal year 2021 and decreasing to 7% through the first 4 months of fiscal 2022. The highest percentages were in Allegheny County and Southern Maryland, and also in Howard County. Moving to the third issue in the analysis, this includes discussion of the low-income household water assistance program. As mentioned previously, this was a new program announced by the U.S. Department of Health and Human Services and one of the fiscal 22 deficiency appropriations of federal stimulus funding for implementing the program in Maryland. The agency has submitted a grant implementation plan to HHS, and the program is now accepting applications. The grant implementation plan indicates that the eligibility criteria for benefits under this program are at 60% of Maryland's median household income, and that there is also going to be categorical eligibility with other applicants who are already eligible for energy assistance program benefits or other assistance benefits through other programs of DHS, also categorically eligible for benefits through the water assistance program, which include both bill pay and arrearage assistance for wastewater and drinking water. And we're including in our list of recommendations committee narrative, asking the department to provide some follow-up later on next year on the use of federal stimulus funds for this program, as well as a status update on how the program is progressing in Maryland. Moving to the recommended action section of the document, the Department of Legislative Services is including recommendations for 3 items of committee narrative. The first is on energy assistance application processing times and denial rates. This is similar to data that's been requested and provided in previous fiscal years, including the number of applications received per year, the average processing times for applications, as well as the denial rates and reasons for denial for each of the 4 energy assistance programs. The second recommendation is relating to the implementation of categorical eligibility. In the updates section at the end of this analysis, there's an update on some of the efforts that the department has indicated in one of their JCR response reports on implementing categorical eligibility in the Office of Home Energy Programs. And this report provides, is asking for the department to provide an additional status update later on next year for some of the steps indicated in the report that they submitted last fall. The main changes include the integration of the OHEP data system with the new enrollment and eligibility system as part of the MD Think IT project, as well as establishing a centralized administrative model through the local Department of Social Services, which is centralized with other cash assistance benefit programs and other areas of DHS. The third recommendation, as previously mentioned, related to the Household Water Assistance Program. This is asking for an update on the implementation of that program in Maryland, as well as an update on how federal stimulus funds have been used for that purpose. That will conclude the DLS presentation, and I can take any questions from the committee at this time.
Thank you. Are there any questions? I'm trying to, if any, okay, I do not see any hands up. Okay, thank you for the analysis. We'll bring the department up. We'll have Secretary Padilla, Mr. Stafford, and Ms. Molyneux from DHS.
Good afternoon, Chair Valentino Smith and members of the committee. Thank you for the opportunity to discuss the fiscal year 2023 budget allowance for the Department of Human Services Office of Home Energy Programs. Thank you for introducing my team. I want to take the time to thank Samuel Quist, the DLS analyst, for his comprehensive and thoughtful analysis. He's a pleasure to work with, and we appreciate all his support. You have my written testimony, which I won't repeat here. Before I address the recommendations and issues in the analysis, I do want to take the time to highlight some of our accomplishments. The Office of Home Energy Programs, or OHEP, provides critical benefits to thousands of households in Maryland. The budget includes $91 million of additional funding and a total of $392 million for the energy assistance programs to be spent across fiscal year 2022 and fiscal year 2023. This funding would allow OHEP to increase electrical bill assistance benefits by 100% and increase gas bill assistance by 66%. During the fiscal year 2021, OHEP provided benefits to more than 85,000 households with assistance in 4 areas: heating benefits, electrical bill assistance, electrical arrearages retirement assistance, and gas arrearages retirement assistance. The average benefit for these programs range from approximately $500 to more than $1,000. In addition to the regular funding, OHEP received more than $19 million from the CARES funding. This funding provided an average supplemental benefit of $747 to more than 25,700 households. We know that when people reach out to us, they're already in distress. Getting their benefits to them as quickly as possible is always a priority of the department. The average processing times statewide improved by nearly 30% since 2015, with average processing times declining from 30 days on average in 2015 to 22 days in 2022. OHIP continues to focus on improving access for the most vulnerable populations and streamlining the process to ensure those eligible for benefits can easily navigate the application process. In fiscal year 2021, the percentage of eligible households with applicants 60 years of age or older receiving benefits increased by 10%. And we also saw a 10% increase in benefits going to households with disabled members. Another program of targeted outreach is the Critical Medical Needs Program. This program provides training to navigators in hospitals, cancer centers, and similar facilities. These navigators work with recovering patients to ensure that they have energy assistance when they return from treatment. OHIP has already trained 383 navigators. 56 more navigators are ready to be trained in the coming month. The Low-Income Household Water Assistance Program, or LIWA, is a new federally funded assistance program targeting low-income households that have past due water bills. Benefits may range from $100 to $2,000 and are paid directly to the water utility company. That concludes my opening remarks. Now, with your permission, I will move directly to the recommended actions and issues in the analysis.
Thank you.
The
And
DLS
the chair has returned. If I just can point out to everybody, I have to hand the reins back over.
Shortest bill hearing ever. It's my favorite kind. Secretary Padilla, you were about to speak. Please go ahead. Don't let me interrupt.
Thank you. The DLS analysis contains 3 recommended actions. The department concurs with all the recommendations. Turning now from the recommended actions to the 6 issues for discussion. In response to issue 1 regarding factors impacting the volume of applications and the department's outreach efforts, since the start of the COVID-19 pandemic, Marylanders have benefited from the priority of pandemic-related special assistance programs. This increase in assistance seems to have contributed to the decreases in applications. We expect an increase in applications by the end of the fiscal year 2022 as these special assistance programs expire. We're working with the existing partners, such as the SNAP outreach networks, to identify eligible households that may not be receiving energy assistance. In response to issue 2, regarding the number of additional households with an individual age 67 or older, we have benefited from the increase in income eligibility. As of December 2021, 489 households with an individual age 67 or older have benefited from the change to the income eligibility. In response to issue 3, regarding the impact on overall denial rates and denials for incomplete information that may have occurred as a result of the change in income eligibility, a comparison of denial rates from fiscal year 2021 to those during the first 5 months of fiscal year 2022 reflect a steady decline. This is because of the policy change, which allows applicants additional time to submit documentation. And we expect the denial rates will continue to decrease. In response to issue 4, regarding any factors impacting the mid-year increases in denial rates, particularly for arrearages assistance benefit, OHIP identified 4 main factors impacting the denial rates, and particularly denial rates for the electric arrearage assistance. First, the customers are applying for arrearages before the 5 years have lapsed for their eligibility to renew. Second, households are applying earlier and not waiting to be in a state of emergency, which results in not meeting the minimum benefit amounts. Third, households were applying for every program listed on the application. And finally, households applying for gas arrearages when their house is not heated with gas. In response to issue 5 regarding the increase in application processing times that occurred in some jurisdictions, OHIP services in Howard County and Southern Maryland are provided through the local community action agencies and not the local Department of Social Services. The application processing time increased due to significant staffing turnover in both agencies. OHIP is working with both organizations to improve timelessness. In response to issue 6 regarding the launch of the new low-income housing water assistance program or LIWAP response program, LIWAP began accepting applications on January 31st, 2022. We expect to start delivering benefits by the end of March 2022. This concludes my testimony and responses, and I will be happy to address any questions the committee may have. Thank you so much.
Thank you. Any questions for the department? Delegate Valentino Smith.
Thank you, Mr. Chairman. Thank you, Madam Secretary. And certainly we recognize it's been a challenging time for you as this population in need of energy assistance has only been increasing during the pandemic. And while it's certainly enlightening to hear that the benefits have been significantly richer because of federal help, which is very encouraging for the vulnerable. We continue to have wanted to pursue with you the denial rates. And sometimes my concern in previous budget hearings that we're not trying to decrease the amount of time to get you to hurry up and deny. That, you know, and looking at the number of days, it's for the reasons. And so on page 19, I tried to talk a little bit about the most common reasons for denial being incomplete information. And you suggested that that might be a little bit because of result in income eligibility and policy changes. You said that you remain hopeful given the bill that passed that provided extra time that would be a decrease in the denials. But providing extra time, if there's still a problem with information incomplete, may not solve the problem. Somebody's not really reaching out and helping to figure out what information wasn't provided and why. Again, I think we've talked about these are very vulnerable people, these types of documents, transmitting them, locating them, understanding exactly what's needed. What is the program with the local health departments or the administration of this to find out where it says information incomplete? What's the main information and how are you helping them get the application complete rather than hurrying up to deny them?
Thank you so much. That's an excellent question. And as always, we share the same results, and we definitely don't want to deny the application, be avoided. And I'm going to ask the director of the Office of Home Energy Programs, who works very closely with the local Department of Social Services and the community agencies program, to elaborate on new initiatives and new approaches that we have since launched to help the families. Lauren, if you will.
Thank you, Secretary Padilla. Thank you, Madam Vice Chair. I'm happy to answer this question. It's a little bit nuanced in that when we think about the 90-day approval time, when we report to determine why somebody was approved or denied, those folks that were denied, if we run it outside of that extra 90 days, we're seeing that that is actually not the most common reason, that folks are not getting denied for incomplete information. So what we've noticed is that those efforts that we are undertaking while they're in that 90-day time frame is resulting in somebody coming back with the appropriate documentation and either being denied for, say, over income or a different reason, or ultimately approved, which would be the goal. So by taking a look at when we pull the reports and determining when that case was approved or denied, we are actually seeing a very uplifting change in the reason why those cases are being denied.
So I appreciate you referenced it with saying, were you finished? I'm sorry.
Yes, ma'am.
So I appreciate you prefacing it with saying it's a nuanced and your hopefulness. I'm wondering if not too much administrative work, if you could get together with Sam Quist, our analyst, and look at Exhibit 10 provided and clarify that detail then on the edits that you have in your program for the reasons for denial, if it's not incomplete information, because we're seeing in Exhibit 10 that the most common reason for denial. Try to give us a better or clearer picture on what help applicants are getting so that the applications, like you said, the desires to try to get as many eligible approved. Mr. Chairman, can I ask one more question?
Sure.
So I know that Secretary, you talked about the fact that there's some denials because people apply within their before the 5-year period, not being able to apply again. Is that a federal rule or state rule? What's that time, that extended time period?
That is the how the program is designed. Lauren, if you would elaborate on what I'm pretty sure is in regs, but if you were elaborate on that.
Yes.
Because let me just, before you answer, Lauren, sorry. So what we need to try to understand here, make it simple for me, is federal law either requires it and we have no room to bend on the 5 years, or we do have room to bend and we just have not.
Understanding your question.
Thanks.
Thank you, Madam Vice Chair. Yes, that is a state regulation that was actually recently amended, reducing it from 7 to 5 years. So that regulation has been recently changed.
When was that changed?
I believe that was last legislative session.
Okay, I appreciate the clarification. Sorry, I did not have that recollection, but I appreciate it. Thanks for the work. Thank you, Mr. Chairman.
Thank you. Are there any other questions for the department? Seeing none, thank you very much. I believe there is written testimony in everyone's packets from Sorry, my apologies, a little technical difficulty. We have written testimony in our packets from Stacey Jefferson from Marylanders Against Poverty. And that then concludes the bill hearing for the Office of Home Energy Programs. We are now going to move on to the Department of Health's Public Health Administration and the analysis presented by Ann Wagner. Take it away, Ann.
Thank you very much. Mr. Chairman, members of the committee. I think everyone should be able to see my screen, so I'll jump right in. This is the budget analysis for the Public Health Administration under the Department of Health. This includes most of the offices under Public Health Services, except for Prevention and Health Promotion Administration, which you'll hear next week. On this first page, you can see, sorry, let me move it over a little bit. On this first page, you can see the fiscal 21 actual spending for these offices reflects over $1 billion in COVID-19 related expenditures. This is mainly in the Office of Preparedness and Response, where significant amounts of the state's pandemic response and public safety personnel funding was budgeted. Page 3, I'm not sure why it keeps jumping over, but page 3 outlines the sources of this funding in fiscal 21, including $792 million in local income tax reserve funds added through a budget amendment, and then $534 million in federal coronavirus relief fund spending, and $341 million in general funds. And the $341 million in general funds also accounts for FEMA reimbursement. And so the department is asked to discuss how the allowable uses of FEMA funding have changed over the course of the pandemic. And then I will point out, though, that overall the PHA budget decreases by $217 million in fiscal 23. But what Exhibit 1 shows is that when you exclude the COVID-19 related spending, the budget otherwise grows slightly. especially as the general fund appropriation increases by almost $20 million. There are three deficiencies adding funds in fiscal 22. Each of these uses are related to the pandemic and were supported with federal funds in prior years, mostly in fiscal 21. So the department is asked to discuss whether federal funds would be available again for those purposes. Pages 6 and 7 show the itemized list of budget changes from fiscal 22 to 23. For today, I'll skip ahead though to a couple discussions of some of the major budget changes. Make it a little easier to read. First, I'll go over some of the COVID-related spending. Part of the overall decline in PHA's budget is driven by the end of COVID funds, including $16 million from the CDC's initiative to address COVID-19 health disparities that was spent in fiscal 22. The uses of that funding are shown on page 8, but it generally supports community health workforce. It develops a healthcare workforce data center, and then the funding provided assistance to local health departments and community partners. One place where there's actually more COVID funding is in fiscal 23 compared to fiscal 22 is American Rescue Plan funding to support the public health workforce. Of Maryland's $31 million grant over 2 years, the vast majority of that was passed through to local health departments with the federal guidance that 25% should be supporting nurses and personnel in school-based health programs. Moving on to the next budget discussion, this relates to the Maryland Loan Assistance Repayment Program for physicians and physician assistants. This program was funded with $1 million in fees from the Board of Physicians Fund in fiscal 22, but in the fiscal 23 allowance, the budget is now including $1 million in general funds and $400,000 again from fees under the Board of Physicians in fiscal 23. There was a stakeholder work group that was convened to report on permanent funding sources for the MLARP program. And one of the recommendations from that work group was to invest in a permanent general fund appropriation. MDH disagreed with that particular recommendation, but as I said before, the fiscal 23 allowance does have $1 million in general funds for the program. Moving on to personnel. The budget increases by 16 positions as the Office of the Chief Medical Examiner receives a net addition of 20 positions. This is partially offset by 5 positions within the Primary Care Program Management Office that are being transferred to the Medicaid office. The other point I wanted to discuss with the personnel is that last year, the Joint Chairman's report included narrative asking MDH to submit a report on specifically on public health vacancies and recruitment efforts, including public health at local health departments. Because this report has still not been submitted, there is a DLS recommendation to add language restricting funds for administrative purposes until a new report on public health recruitment and retention is submitted by December 1st of 2022. There are 2 key observations in this analysis today. The first relates to the local health department funding in the allowance. So the first exhibit here shows sorry, I lost my place for a minute. This first exhibit shows total formula funding over the years. You can see following the Great Recession, there were significant cuts from when the formula funding was over 70 million to about 40 million shown in fiscal 2010. Over the past few years, the formula funding has risen above 60 million. And then in fiscal 23 in the allowance, you're seeing there's a discretionary enhancement that brings the funding back up to 2008 levels. Last year, there was also legislation passed that would rebase the funding formula at 70 million in fiscal 25 and then 80 million in fiscal 26. So this discretionary enhancement in 23 kind of accelerates that effort for 1 year in fiscal 23. Moving to Exhibit 5 on page 14, this shows the components that make up the formula funding from fiscal 21 to the 23 allowance. I'll highlight here that in fiscal 21 and 22, local health departments received $9 million and $9.4 million to cover pandemic-related shortfalls among their fee-for-service clinics. And in fiscal 22, this funding would be added as a proposed deficiency. In fiscal 23, you're seeing that there isn't funding for those clinics as patient volume is expected to return to normal levels. and it was one-time funding during the pandemic. But there is instead this $7.6 million general fund appropriation as a discretionary enhancement. And so when you combine the 7.6 million with the mandated formula increment of 2.8 million, the local health department formula funding increases overall in fiscal 23. I will note though that considering this $7.6 million enhancement wasn't generated through the formula, the fiscal 24 formula amount won't necessarily stay at this elevated level. So the department should comment on any plans it has to hold local health departments harmless in fiscal 24 before the formula is again rebased in fiscal 25 at that 70 million fund level that was required as part of the legislation from last year. The next exhibit shows the local health department funding allocation by county. This is specifically for that $7.6 million discretionary enhancement. So based on supporting budget documents that DLS had received, the discretionary enhancement would have been allocated differently than the typical formula funding. You can see through the blue bars here, this is the percentage allocations that counties would have received based on the formula allocations. And then the red bars show the allocation based on the estimates we received with the budget. The black markers show what that meant for counties on a dollar basis. You can see that Baltimore City would have lost about $450,000 of the discretionary enhancement if the funding was allocated differently than the formula. So due to these differences, the department is asked to clarify how that discretionary enhancement will be allocated, whether it's based on the formula allocations shown on the blue bars, or if it's this estimate shown on the red bars. And then clearly during the pandemic, I'll skip ahead to exhibit 7. Local health departments have played a crucial role in the state's pandemic response, and they've also received a substantial amount of federal funding and some state funding outside of the annual formula. This exhibit on page 17 shows some of the funding sources that have been made available during the pandemic. They were generally going to be provided on a one-time basis, but I did want to highlight the $8 million in infrastructure grants going to local health departments, as this is budgeted as $4 million in general funds in fiscal 23. This funding is budgeted separately from the annual formula, and it hasn't been clear how that $4 million total was decided. So MDH is asked to discuss how that funding level was determined. And then as discussed before, there is also that 7.6 million discretionary funding provided on top of the formula. And so this was the reason for this was to bring local health department funding back to 2008 levels, but it's not clear whether the $4 million in infrastructure grants plus that 7.6 million discretionary enhancement actually correlates with the actual cost of providing public health services, or whether it meets community health need on an ongoing basis. And at the same time that there's a lot of this ongoing one-time federal funding, and then discretionary state fund allocations. There was also chapters 29 and 31 passed during the 2021 special session that require the department to convene a public health modernization work group. And so part of the charge of this work group is to assess current public health infrastructure and then make recommendations for establishing an effective public health system moving forward. The department is asked to discuss its timeline for convening this work group, its priorities for the work group, including whether it would consider changes to the local health department funding formula, and then if there are any preliminary efforts to support ongoing local health department operating and personnel costs as a lot of the one-time pandemic funds end. So that is it for the local health department related key observation. The second one gets into recent staffing shortages affecting the Office of the Chief Medical Examiner. First is background. OCME receives accreditation from the National Association of Medical Examiners, or NAME, when it meets certain standards for investigations, morgue operations, staffing, and other standards. And these are categorized with phase 2 violations being considered essential requirements. And so if an office receives any phase 2 violations, it means that the office would not receive full accreditation. During the pandemic, however, NAME announced that it would not demote an office's accreditation for staffing violations or other issues that were tied to the pandemic. And so most recently, OCME received full accreditation as of March 19th of 2021, and that was while the pandemic-related violations were waived. Previously, OCME has received phase 2 violations for 2 different reasons. And so for the first one, most recently, the issue was with the roof of OCME's building in Baltimore City having leaks and flooding issues. And so OCME has worked with DGS on a project to fix the roof with an expected completion date of November 29th, 2021. So MDH is asked to provide a status update on whether that completion date was met. The department should also discuss when it expects NAME to begin enforcing the staffing and other pandemic-related phase 2 violations for determining accreditation. The other cause of OCME's past phase 2 violations has been OCME's challenges with staffing. And at the same time, as the staffing shortages have happened, there's also been an increase in autopsy caseloads. And so Exhibit 8 on page 20 shows the caseload ratio. This is the measure that NAME uses to determine adequate staffing levels. It's the ratio of number of autopsies performed to the full-time equivalent medical examiners. And in order to receive, or in order to avoid a phase 2 violation, offices need to have fewer than 325 autopsies performed per medical examiner. And so you can see with that line on this chart, that's where the phase 2 violation would begin. And most recently in fiscal 21, OCME has grown significantly higher than the phase 2 violation, with about 390 autopsies required per medical examiner. You can see through the yellow bars, this is partially related to the increase in autopsies required over the past few years. This has grown every year as overdose deaths and homicide deaths have both increased. But most recently in fiscal 21, you're seeing that there was a 17% decrease in full-time equivalent medical examiners. So this was the driving factor in the phase 2 violation in fiscal 21. And the fact that medical examiners have on average had to perform 65 more autopsies than the standard 325 autopsies per medical examiner. Exhibit 9 shows recent medical examiner vacancy trends. As of December 2019, the office had 18 filled medical examiner positions, which are shown on the blue bars. But as of December of 2021, there are only 15 filled medical examiner positions and 4.5 vacancies. There are also more vacancies expected in the future as 3 medical examiners are expected to retire. To fill in some of these vacancies, OCME also pays board certified MEs on a per diem basis for traveling to Maryland and performing autopsies, mostly on the weekends. But this is a way that the office has been filling in for some of these vacant regular positions. You can see that in some years, the use of the per diem program has completely covered the vacant medical examiner positions in 2017 and 2019, where you're seeing this line that includes the per diem cases has surpassed what would have been filled even at full staff capacity. But in fiscal 21, you're seeing that the per diem program has shown a large decline. And this is mostly related to the pandemic, as some of the per diem pathologists weren't able to travel. And then there are also increased caseloads at other medical examiner offices that have made it so that pathologists are not as available to schedule work in Maryland. Considering these persistent staffing issues, the department has described the following recruitment efforts through multiple responses to the budget committees. Some of the recruitment efforts include using a recruitment specialist, implementing a training program, and approving some salary enhancements through the annual salary review. Most recently for medical examiners, there was a 12% increase effective December 2020. The fiscal 23 allowance doesn't include annual salary review adjustments for medical examiners, but it does. I will note that this analysis focused on medical examiner staffing, but OCME has previously described high turnover in other positions, such as forensic investigators and autopsy assistants. There is an annual salary review adjustment for forensic investigators. So I did want to note that. And then for the office overall, the fiscal 23 allowance includes 20 new positions. And you can see from the chart on page 24, 5 of these would be forensic investigators, 4 of them would be autopsy assistants, and then 3 are medical examiners. But otherwise, the allowance doesn't include annual salary review adjustments for medical examiners in particular. So the department is asked to discuss why the budget didn't provide funding for ME salary enhancements or other uses to recruit the current vacant slots instead of or in addition to funding these new positions. The department should also describe its recruitment efforts, especially as additional MEs are expected to retire over the next year. And then just in closing, there are 2 recommended actions related to the Office of the Chief Medical Examiner. The first is to adopt language restricting funds until MDH submits a report on OCME's accreditation status and its recruitment and retention efforts. And then the second is a recommended narrative that requests a report from the department, the University of Maryland, Baltimore campus, and MHEC on efforts to increase the number of forensic pathologists graduating from higher education institutions, and then any programs to provide financial assistance to those students. And so with that, I'll conclude the presentation. I'm happy to answer any questions.
Thank you. And I have actually a couple questions for you. The first question is, you had mentioned that NAME has suspended the penalty program for taking away accreditation because of for COVID-related issues. In previous meetings, the department presented that their problem with the ME's office is not necessarily COVID-related. The heightened number of deaths that are occurring are related to overdoses and homicides. So if that is the case, is COVID really the reason why we have not gotten the accreditation suspended, or is it just that NAME has simply not engaged in suspending any ME's offices during COVID?
I can't speak to other offices and whether NAME has taken away accreditation elsewhere. I know that they have announced specifically that there are staffing issues related to the pandemic. I know travel restrictions, and you can kind of see with that per diem program showing a lot fewer cases, that I think that's the way it's been tied to the pandemic on the staffing side of things. But I think that the department would probably be in a better position to speak about NAME's timeline for when it will stop. That was one of the questions in the analysis, was when NAME is going to start demoting accreditation status again in the future. And so I'm sure that.
And can you highlight, for the sake of the committee, what it means to have your accreditation demoted? Like what happens to the ME office if they're not accredited by NAME?
So in the past, I mean, having accreditation is a sign for when medical examiners are called to testify in court and are called to speak to the reason for a death in certain cases. It provides a credibility, and it provides support that the office is running with, meeting all the standards of a sufficient program. And so I think it has a lot to do with credibility. But again, the department can discuss to the details of what happens when the office loses accreditation. But it also has been on provisional status in the past. So oftentimes, if you have a phase 2 violation, the office would first go to a provisional status. So it might not necessarily lose. It might lose full accreditation, but it might receive a provisional or partial accreditation, even if it has a phase 2 violation.
Okay. Well, thank you for that. Any other questions for Ann? All right, seeing none, let's move to the department. With us today are Secretary Dennis Schrader, Deputy Secretary Jinlene Chan, Chief Financial Officer Amalie Brandenburg, Budget Director Nick Napolitano, and Assistant Secretary Webster Yee. take it away, team.
Thank you. Thank you. Thank you.
All right, that's a really bad echo. I don't know if everybody heard that. All right, are you okay?
Can you hear us now?
That works better. Thank you.
All right. Thank you, Mr. Chair. And members of the committee. For the record, my name is Dr. Jin-Ling Chan. I am the Deputy Secretary for Public Health Services, and Secretary Schrader is currently in a Finance Committee hearing and will join us as soon as he is able. And so I am, as you indicated, joined by my colleagues, Emily Brandenburg, the Chief Financial Officer for the Maryland Department of Health, Webster Yee, who is the Assistant Secretary for Health Policy, as well as Nick Napolitano, the Director of our Budget Office at the Health Department. I want to thank our budget analyst, Ms. Wagner, for her very careful and detailed analysis of our budget. And I'd like to first turn to Ms. Brandenburg for a response from the department.
Thank you, Dr. Chan, and thank you, committee members, for having us here today. For the record, I'm Emily Brandenburg, the CFO for the Maryland Department of Health, and I will be responding to the first several recommendations. Concerning the FEMA Public Assistance Grant Program, there have been several changes throughout the course of the pandemic. Most notably, the shift from being completely focused on direct efforts to address COVID-19 itself to expanded eligibility that includes efforts to facilitate the safe reopening and opening and operation of eligible buildings and facilities. FEMA shifted their standard 75% federal reimbursement formula to 100% reimbursement in early 2021. Additionally, the eligible time period continues to shift as the pandemic has also continued. To date, the state of Maryland has received $757 million in FEMA reimbursement for Maryland Department of Health related COVID-19 costs. There's approximately an additional $87 million submitted by the department and is under review with FEMA. A May of 2020 FEMA memo asserts that all COVID-19 projects must be submitted for their review by 60 days after the end of the U.S. Department of Health and Human Services Public Health Emergency Declaration. The current public health emergency is set to expire on April 16, 2022, and as such, the department will comply with all FEMA public assistance submission deadlines. Concerning the use of the ARPA funds for the 2022 deficiency items listed, the funding awarded directly to the Maryland Department of Health by the federal government through the American Rescue Plan Act of 2021 has been fully obligated. We support the governor in his discretion on the use of his state and local fiscal recovery funds. You asked to submit a report on the public health recruitment and retention. The Maryland Department of Health respectfully disagrees with this recommendation. We are submitting a report on this topic regarding the prompt on page 94 of the Joint Chairman's Report for the 2021 session. I wanted to make note concerning the plan to hold all local health departments harmless in the future. We respectfully support the governor's budget as submitted, and any future budget decisions would be at the discretion of the new administration. We have provided the final county allocations in our written response. As Ann mentioned, these were estimates when they were first given. The core service enhancements will be allocated to the jurisdictions using the core distribution formula. We've also provided the county allocations for the $4 million infrastructure grant program. In short, each jurisdiction receives a base award of $100,000, and the remaining $1.6 million was reallocated based on population distribution. These awards, in combination with the increased investment in fiscal year 23 core funding and continued COVID-19 funding, such as the ELC awards, should significantly support LHD, local health departments, infrastructure. And lastly, before I turn it back to Dr. Chan, at this time, the Maryland Department of Health is focused on responding to COVID-19 and the network security incident. We will endeavor to convene the Public Health Modernization Work Group when circumstances permit, as specified by Chapter 31 of the 2021 special session.
Thank you, Emily. I would like to address all the talking points and points pointed out by Ms. Wagner regarding the Office of the Chief Medical Examiner. I first wanted to recognize the work of the office and all of the staff. It is often a thankless job to conduct forensic investigations and perform autopsies, and importantly, work with families during what is arguably the worst time of their lives when they have just lost a loved one. We at the Maryland Department of Health recognize the work of the OCME as critical to Marylanders across the state. The national picture for forensic pathologists shows a crucial shortage for that particular subspecialty. There are only about 750 board-certified forensic pathologists available across the country, according to the National Association of Medical Examiners, or NAME, which makes this a very difficult recruiting environment for all medical examiner and coroner offices in this country, including, of course, here in Maryland. So against that backdrop, I'd like to highlight some of the work that MDH has been doing in the last year and previously, working with the Postmortem Examiners Commission to reinforce the work of the OCME. When the Chief Medical Examiner, Dr. Victor Wheaton, who just started last year, he put forth a number of requests to augment and support the work of the OCME, and the department has endeavored to meet those requests. Wanting to point out that forensic pathologist salaries have increased by over 50% since prior to October 2020, when an enhancement was provided. And at the present time, we are among the highest salaries when we look at the current recruitments for forensic pathologists across the country. The range of salaries as of January 2022 for a board-certified assistant medical examiner starts at $238,842 and goes up to $370,000. These figures also reflect a 3% increase, which was included as part of the salary enhancements provided for in the governor's budget. I would also refer you and the committee members to the JCR that we submitted back in August of 2021 regarding OCME staffing, as well as the more recently updated information that we updated and provided last week. In 2019, ASRs were also approved for autopsy assistants. And in direct relation to some of the requests put forth by Dr. Wheaton and the OCME over the last year, as noted by Ms. Wagner, we have added 21 new positions at the OCME, including the additional assistant medical examiner positions, forensic investigators, assistant toxicologists, and autopsy assistants to assist with this growing workload at the office. We are also discussing additional retention options with the Postmortem Commission and the Department of Budget and Management. So look forward to how that might work out as we continue those discussions. And then last, as was also noted, we did have an ASR that was approved for forensic investigators, which will constitute a 2-grade increase to take place in fiscal year 2023. We are in the process of identifying additional forensic pathologists who will be able to come in as per diems to assist with autopsies. So that's an important additional level of work to bring in more staffing to our office. And in terms of some of the equipment and infrastructure needs, we have approved a capital project to add additional permanent cold storage capacity at the OCME's office, which will move forward. And in the meantime, we have also funded additional temporary cold storage facilities. In addition, a new CT scanner, which has been an important piece of equipment that has been in need, has been purchased, and we anticipate installation just next month in March. So working with the manufacturer on that. So throughout this whole process, we have been working very closely with the Postmortem Examiners Commission, including the chair, Dr. Sanford Stass, and vice chair, Dr. Ralph Rubin, to look at ways to increase resources as well as enhance the processes within the office. So I'd like to turn to some of the specific items in the budget analysis. So first, regarding the building, the OCME's building, the roof and siding replacement project, I'm happy to report that this was completed and inspected in December of 2021. with a final evaluation completed last week. The total cost of this project was about $3 million, which includes the architecture and engineering fees. In relation to the name accreditation, at this time, we do not have information from NAME in terms of when they are planning to resume its usual accreditation activities. We are in continuous discussions with them to understand where they are in that process. This is something that is not specific to Maryland, but across the country. Our next self-evaluation, however, is due in May 2022, so just a few months away. Excuse me. And a full inspection by NAME is not expected until next year in 2023. Last, we would respectfully disagree with the budget analyst's recommendation to restrict funding to the Office of the Deputy Secretary. As I just noted, the OCME staffing JCR was just submitted last year and were also recently updated. I also just outlined some of the additional steps that we are taking with the commission now to increase staffing as well as to enhance recruitment in the office. Regarding the report regarding consultation with UNB and MPEC, we have actually already been in active conversations about this, as well as other potential enhancements with Dr. Stas, the chair, as well as the vice chair, to identify other ways that we could enhance support to the office. I would note that we have a state general fund funded fellowship program that has been very successful, that has been a primary source of new recruitments for permanent assistant medical examiner positions. And so this has been ongoing for many years. So we continue to support our fellows in this forensic pathology fellowship pathway. For more details, I would refer the committee members to our written response. And with that, I want to thank again the committee, the budget analyst, and Mr. Chair. We are now happy to answer any questions you may have.
Thank you. Ooh, that should be okay. All right. We have lost a couple of members due to bill hearings. I know Delegate Valentino Smith and Delegate Henson are both in bill hearings right now. Delegate Young or Delegate Mangione, do you have any questions for the department? Because I have a few. All right. So before we get into the Office of the Chief Medical Examiner, and because Secretary Schrader isn't here, Mr. Yee, I don't know if you're able to answer this or not, but I have a special question from Chair McIntosh. She had requested information during a meeting on January 26th dealing with school-based health centers. Apparently the department was going to get back to her on that, and he has yet to get back to her on that. So I wanted to get for her the status of that response.
Can you hear me now?
Yes, I can.
All right, sorry, we've got some technical issues, apologize. With respect to the division question from Chair McIntosh, we're working on the response with the MCOs right now. We've been in active communications with both Mr. Kumian of Priority Partners and also Nikki McCann and other leadership at Hopkins on this issue. We're trying to get the response out to the chair as soon as we can, and it's still very much a work in progress right now. So again, we will get the updates to the chair hopefully today or tomorrow.
It is my understanding that we're going to have a hearing on the 21st. Do you anticipate having an answer before then?
I can guarantee that we are working on this issue, Mr. Chair, and we'll be able to provide an update.
All right, well, I will get back to her on that. With that, I have a whole list of questions about the Office of the Chief Medical Examiner. Starting with news reports have indicated that the office has requested assistance in doing autopsies from FEMA. Is that accurate, and what is the status of that request?
Thank you, Mr. Chair, for that question. So yes, working with our partners at the Maryland Department of Emergency Management, we have submitted a request for an assessment for potential deployment of resources. So that has just started. So no commitments have been made from the federal government.
Okay. And as of today, can you tell me what the autopsy backlog is in the office right now?
I do not have that number in front of me right now. As of, I believe, earlier this week, it was over 200.
And is that number going up or down based on the number of autopsies being performed on a daily basis?
It has been rising over the last several weeks. It has slowed down in terms of the overall increase. There are autopsies, of course, being performed every day, including over the weekend, using both staff assistant medical examiners as well as the per diem staff.
And are all decedents properly stored at this point? I know that up until a couple weeks ago, the office couldn't guarantee that everybody was properly stored so that a proper autopsy can be conducted. Is everyone properly stored at this point?
As I referenced in my opening remarks, in addition to the commitment for a more permanent expansion of cold storage that through the capital budget, we also have funded additional temporary storage capacity, both at the Office of the Chief Medical Examiner location and in relation to the COVID pandemic, the additional offsite location that is being used not only by the Chief Medical Examiner, but also the State Anatomy Board.
Okay, and I did get that during your remarks. That does not directly answer the question that you have enough storage for all of it.
So yes, so to be clear, the additional storage that has been provided allows adequate capacity to store decedents that may be awaiting an autopsy, as well as decedents who are completed and awaiting funeral homes.
Okay, one last question. With regard to the roof repair, I'm glad it's finally done. It took 2 years, obviously, since the last NAM inspection. Isn't that building relatively new?
It is. I believe it opened, and I'm going to forget the year, I think about 10 or so years ago, or maybe a little bit more than 10 years ago.
Okay, so after 8 years, there was a massive roofing problem that cost $3 million to fix. Is there any kind of warranty or, any kind of assurance from the original contractors that would be in play here?
Mr. Chair, we'll check back with our partner state agencies on that question and get back to you.
That would be great. Thank you. Roofs shouldn't fail after 8 years. So there might have been a real problem there that needed to get addressed. So with that, I don't have any more questions. Does anyone else have any additional questions for the department? I know Delegate Henson has just joined us. I don't know if you wanted to jump in on anything. No. All right. Thank you very much. Okay. With that, we're going to move to public testimony. Let me make sure I have my list here. We have one individual signed up to testify orally. That would be Miss Cindy Smalls of APSME. And then afterwards, I will announce who has submitted written testimony. So Ms. Smalls, please go ahead. You are limited to 2 minutes, but go ahead.
Yes, thank you, Mr. Chairman and members of the committee. I will really be brief. I want to first thank Ms. Wagner for her analysis of the department. I think she was right on spot and kind of highlighted some of the quick points that I wanted to make. Of course, we've talked about staffing and ASME as a union, we will continue to talk about the lack of staffing, understaffing in our state agencies, particularly in the local health departments. And recently, we've been talking about OCME and the lack of staffing there. So I want to thank the committee for raising and asking the question, because we will continue to do that. The second thing that I want to raise is that we're glad that there are long overdue COLA steps and raises in the budget. We're happy to see that. But I would like to highlight something that Ms. Wagner indicated in her analysis around a small group of forensic science investigators who will be getting an annual salary review raise. While they do deserve that, and we are happy for them, we think that there are other positions that we should take a look at and don't know why they were left out. Positions, for example, like autopsy techs, who recently received a $15 raise, but there are other critical positions that I think that we need to look at within the local health departments in looking at their salary adjustments. With that, again, I'm just brief. I just wanted to raise those 2 points, and I thank you for your time and in your help. Thank you.
Thank you. Any questions for Ms. Smalls? All right, seeing none, I just want to announce to the committee, we also have written testimony from Kevin Chanchow of the Lith Home LLC, and then Akila Smith as an individual. So with that, I believe that is all the testimony for today. That is all for these budgets. Thank you very much for everyone coming out, and we are adjourned until the next time.